Jules has very kindly agreed to come and talk to us about her experience with the fibromyalgia clinics that she attends. She's told me I can stop trying to get my tongue out around it and call it fibro. That's what
That's fine.
She's really freely agreed to do it twice for us, so she came to Chorley South Ribble, and further to that, she's agreed to be filmed as well. Not only this time, but she's going to do one of the Talking Heads film for us as well, so that we can increase the awareness, not only about the condition, but the access to the services, which I think she'll tell us as part of the story has made a real difference to her life.
Sure.
I'll hand you over to Jules.
Thank you.
Okay, hi, I'm Jules Davidson, and I was diagnosed with fibromyalgia, or fibro as I do call it, in 2015. 20 years since the pain has been started, so long time waiting, but at least I got a diagnosis in the end. Getting the diagnosis was a bit of a struggle, but during that period I did go through some difficulties, as a lot of patients do, because you do feel lost, you feel alone, you don't know where to turn because you're feeling this pain. There's no tests at all that bring anything up, because everything brings up anything to do with your body is absolutely fine. So it is such a struggle to get that diagnosis, but at least now more people are aware and there's getting more understanding coming across that it's easy to get that diagnosis. When I was diagnosed, I was then referred to the Minerva Centre and further on to the pain clinics that have been set up. So I went to the pilot one. I found it extremely interesting, and I found it a huge help, because anything that I was struggling with and how to deal with it, where I was stuck with knowing how to deal with it, this clinic did actually provide me that information. They sort of explained issues of how to plan goals, to try and take your focus off it, how to, take your mind, change your focus, some meditation, exercises you can do to help ease the pain. So the meditation and breathing exercises, they're brilliant, because we actually got a print out for those as well, from the nurses who carry the clinic out. So there's all the information. We also got given like an actual book that we can keep referring back to it. There's also forms in there that we can use. So there's a lot of stuff in there that the people who go to these clinics can keep referring back to it and get a lot of information from. There's a lot of the self-help things that I already started doing on my own, because before I got a diagnosis and I didn't know where to go or what to do, I already started taking up my own, sort of filling out a diary, doing a sleep diary, daily diary, how often I fall asleep, the pain, where it was coming, when it was flaring up, what was triggering it. So when I did keep going to the doctor, at least I could show him this example of what's happening. So I was able then to help other ladies who were at these clinics that I was at, sort of to push them more to do self-help as well. The doctors can only do so much. So, they can get us to the point of the clinics, but then it is down to that person to sort of help themselves rather than keep relying on some miracle to happen, because it's not going to happen. So I turned my life around from struggling with it, and I did get quite bad depression with it during a period of time. I just turned my life fully around, and I've become now, my mindset is more battle the pain than fear the pain. But there are a lot of people that still fear the pain, so they won't go out, they won't do anything, they won't go to work, they won't socialise, because they are struggling so much. And it's sort of, the clinics do help to get that message across, to try and help people. If you don't do that, you are going to wallow into like your own quiet bubble. So I'd like to help people myself, because I did it on my own along with the clinics. The clinics were that push further for me, giving extra things what I could do to help myself. And I do check it every day. Other options I've done is I've gone to Amazon, bought Pain Journal, which I've helped other ladies with, and any men who have it, they can use it as well. So I actually do find the clinics very useful. There's only 5 sessions, and it would have been nice to have like a continuation group, but there are own groups in like both Chorley and Preston that you can go to, which we are provided with the cards for those at the clinics. So we are given numbers and contacts of other groups that you can go to for pain. And there's also the research, there's a page in the book with all the links online that you can actually join. with regards to fibro or pain itself, any pain, chronic pain. So I think it should be like an ongoing thing and really push it out to patients to make them more knowledgeable of these groups that can help, and it makes people more aware that they're not on their own. That's the key thing, they're not alone with it, there are other people suffering with the same issue. So.
Thank you very much. Thank you. Anyone? Would you like to ask any questions?
I did ask a question yesterday, Jules, didn't you, about the appointments?
Yes,
timings.
yeah, that's right, yeah.
And you said sometimes weekends would be beneficial.
I think it would, yeah. I wouldn't go with the evening ones because with the chronic pain, I think at that point you're worn out, you're exhausted, and you just want to be in bed. But I think weekends would be suitable, and afternoons definitely still very suitable for that. Yeah. I mean, as much as I work, I work 40 hours a week, so as much as the appointments in the afternoon, I would have found weekends more suitable for me. But luckily, I'm with an employer that lets me take that time out, so afternoons and weekends would be suitable.
Thank you.
Hi Jules.
Hi.
I was going to ask your thoughts on Trisha's point really, because I've got family members who've got fibro. One of the things that they say is you're very up and down.
Oh yes. Yeah.
And how does the service sort of support you in that sense? Do you get continuity of care? Are you able to access things quickly if you go into a down and change your support?
Yeah, the services, where we've got the clinics, they do offer a 12-month aftercare to go back, but unfortunately after that you actually get signed off. So you would then need to go to one of the, sort of research these other pain groups that are held by other people. So that's the only shame about it really, that it does actually end when you get signed off. What you do after the clinic, you are offered a 12-month aftercare. So.
Hi Jules.
Hiya.
We talk quite a lot in healthcare terms around shared decision making with patients.
Mm-hmm.
Just listening to your story, just give us a view about how that felt for you. Do you feel like you've got shared decision making with your doctors and nurses, etc.? How does it work for you?
Yeah, I think I have had the shared decision. I mean, in one case, I said this yesterday there when I had to ask my doctor to see a rheumatologist because I weren't getting the treatment or the expectation I was looking for to get an answer for what I was suffering, because the test won't come up with anything, and I then had to ask to see a rheumatologist. So it would have been nice for them to refer me, but because of speaking to other people, I had to actually ask for that. Throughout the rest of the journey, I have had sort of my input. They've wanted to know sort of like what would be more suitable, and I've had doctors that want to see me every few weeks, which I think is great. So I've said to them, if I could come and see you every few weeks, that'd be great. We'll catch up. Yeah, so I think I have had some of the shared decision with the going through the journey of fibro.
Clinical colleagues, do we?
Oh, sorry. Sorry, it was just something because I was involved in the commissioning of the Moving Well service that you're talking about.
Okay.
And we introduced it late last year.
Mm.
One of the big features of it was this whole self-help aspect,
Yeah.
which you're talking very, very positively about.
Yeah.
It's really, really encouraging to hear. I just wanted to just join one little gap, something you said earlier to Debbie. Did you say that you were given access to other groups once your 12 months had ended, and that it was then for you to do? Or is that something that you think we can change the service to be a bit more proactive in not pushing you into it, but
yeah,
giving you a stronger...
not forcing you to do it,
Yeah.
but I think it would be nice to have that extra support to push people to do it, not
Yeah.
push, but
I know what you mean.
Yeah.
It's not the right word, but...
rather than just saying there's the card of these other groups, it's now down to you, it would be nice to have that sort of backup for them to say, right, try it out, go to these sessions, see how you feel about it. If you don't like that one, try a different one. Or would you prefer like a contact, just for someone, like even a call, just for someone to speak to and it gets you down, or if you're struggling a lot, just that extra bit of care would be...
That's great news and well timed, because we've just concluded the service review, which we're now working with partners who deliver the service, so we can feed that back in. So I'd like to see that as a positive change. So thank you very much for helping us improve the service.
Thank you.
A common presentation in fibro is mood changes, and you mentioned yourself that you had depression. Do you think that any sort of psychological help through the services would have benefited, or were you supported enough by your GP?
I think it would have benefited. I didn't have that. I think a lot of the time when I was going through that dark period, that I do apologise to the doctors here, but I did feel like I was being palmed off a lot, just being pushed away. I didn't think they wanted to understand what I was going through. They gave me like the antidepressants and stuff to take, but I didn't have that support, so I think that would have helped, especially with the people who do still have very bad depression with it, because it does make you feel into that horrible sense of mode where you do feel alone and lost. If they were given that mental health help as well, I think that would be a bonus added to it. Because I think it just drags people down a lot.
Shoes, touching on what you just said, it took 20 years for you to get a diagnosis. That is correct. Yeah. What would have made it shorter?
Awareness of the actual condition, I think. I think it's very unknown. It's been unknown in the UK for a long time. A lot of people I've spoken to, it's either been the same as me, 20 years, 30 years, who I speak to. It's a shame that over in America, fibromyalgia is as common as a cold over there, and they've been treating it a long time, and it's like suddenly it's this new thing in the UK. But it's obvious that people have been suffering from it for a long, long time, and no one's ever known what it is. We've just always seen it as, I think, it's in your head. That's one of the things we had was, unfortunately, it must be in your mind because there's nothing coming up on tests. You're fine, you're affected, everything's fine. So they assume that we're fine, and it's just, I think, a bit more awareness of different conditions and research would have been useful. I think that is happening more now because my daughter's friend, she's 21 and she's just been diagnosed with fibro straight away with what she's been suffering with. So I think it is happening now, which is fabulous. It's great that it's being recognised now. But yeah, I think over the past 20 years it's just been very taboo.
So you think there's more awareness now?
Yeah.
Of the
I think it is sort of getting more recognised and more awareness is what, if we can even expand on that. I think if we can expand on the awareness and knowledge. There are still doctors, I think, that aren't fully aware of what it's about. I was lucky with one doctor at my surgery. I think he'd just come out of training, so he was fully interested in it, and he was the one that wanted to see me every few weeks to get, just to have a review, see how I'm getting on, if there's anything else I need. And I thought it was that's ideal. That's great. I've got someone I can go to. I've now got a different doctor because he left, who is just as good. He is just as concerned about me and what I'm going through than other doctors that I've seen where they're just not interested. So it depends what kind of awareness and what sort of research what goes around. That I think once doctors are more aware of this particular chronic pain condition and fibromyalgia in general, I think it help people a lot more, so that they know that they've got somebody they can go to all the time and just say, right, I'm struggling, where else can I go with this?
While we were sitting there, we were talking about the camera and the awareness of it. So you're okay now to do the talking?
I'm getting used to it. Pretend it's not there.
Thank you so much.
No problem.
Thanks for coming. Sorry, go on.
So can I ask what actually happens in those support groups when you're actually being to see them?
Yeah.
What are the interventions that they actually provide? It's an incredibly difficult diagnosis to get to.
It is,
fibromyalgia,
yeah.
because fibromyalgia most of the times goes hand in hand with chronic fatigue syndrome as well.
Yes, it is, yeah.
Majority of the times it does. And as you said, because there's no actual test to diagnose it, and it's multiple tender spots, and it's a diagnosis given by a rheumatologist.
That's right.
I mean, a primary care doctor can give it as well.
Oh, right, okay.
But you should have that awareness for getting to that diagnosis.
Yes.
I was speaking to a friend of mine, interesting, who's a rheumatology consultant in India.
Yeah.
So this topic came up about fibromyalgia as well. This was only a few weeks back.
All right.
And even in India, the awareness is not that great. So apparently it's more of a diagnosis of exclusion. So once you've ruled out every other condition kind of with all these tests,
Yeah.
and you don't know what actually is causing it, then they're given a diagnosis of
Yeah, it's like a
fibromyalgia.
silent.
And the treatment that they give, this was from a rheumatology consultant, is high-dose vitamin D, and
Right.
then they're sent away.
Okay.
That's the treatment. So I'm just interested in finding out what actually happens in these groups that you go to, because once you go there, we don't get that feedback or information what they
right,
actually
okay.
do in those groups.
Right.
So
Right,
we
so-
get a diagnosis from a rheumatology consultant
Yes.
saying diagnosis of
But you don't know what
fibromyalgia
happens
and
afterwards.
refer to support groups. But after that, we don't get any information.
Oh, right.
As a GP, I've never seen it personally.
Oh, right.
So just out of interest, what actually happens in these?
Well, we discuss all each other's sort of like how they flare ups. Do we have similar root causes? Is there certain things that we all discuss how it affects each person? They talk about different goals that we can do. So we have a list. So we get the notification form that we can say, right, we've all got to think of goals. So that if my goals were photography and art, so I'm going to focus on that. Although I do a job as well, but in night, like say at weekends, I could focus on photography. I can focus on art. Just to take the focus away from the pain. Because if you're sat there thinking about the pain, it's just going to flare. You're just making it worse. Because I think it's psychologically you're thinking about it, so it's getting worse and it builds up and up and up. And then you start panicking, and then you just don't know what to do. So if you can find something, so I throw myself into my job. But so by the time I come home, I fall asleep for 3 hours.
Yeah.
But it's giving people that opportunity to say, right, well, pick a subject, give yourself a goal, see how many times you can do it in a week. It's giving them things to work on and focus on.
Yeah.
And they also offer us the exercises and the meditation programs. So we all do like the Tai Chi meditation exercises, that you can do sat in a chair, so you don't have to over-excel yourself, you don't have to overwhelm, all your muscles, etc. So you can sit and do the exercises at your own pace, the breathing exercises and meditation. So that they've gone through all that in the clinics. We've all done that as a group.
Right. But these don't sound very focused to fibromyalgia. I mean, these could help with a lot of other things.
It could
too.
help with a lot of things.
So these are not like very focused at just purely fibromyalgia.
No, I mean, I'm just saying it from my
Okay.
journey, because that's
Right.
what I have, but I'm
Yeah.
just saying how it has helped me.
Right.
I think other people who have gone to those clinics have had some sort of chronic pain disorder
Yeah.
or condition, and it's to see if it can help them just to get over that fear of the pain and try and relax about it a bit more and deal with it better. It's all about controlling how to deal with it in the clinics, rather than worrying about it and panicking about it that can flare it up. The way you do things on a daily basis, it tells you how you can sort of discuss how you can do things to avoid the pain flare-ups. So yeah.
Sorry, I've got too many other questions, but I'll
No.
probably speak to you later. I'll leave it here.
Thank you. I think we'll have to invite you back.
Okay.
Thank you.
Yeah.
Thank you very much.
Thank you very much.
Thank you.